sponsored by Sanofi and Regeneron.
I'm Dr. Joshua Wexler. I'm a pediatric gastroenterologist focused on taking care of patients with eosinophilic esophagitis.
My name is Megan. I'm the parent of a child with eosinophilic esophagitis.
I'm Matt. I'm a patient with EoE. I was diagnosed when I was 18.
My name is Jenny. I am the caregiver of a child with EoE. EoE can disrupt your life. When you're first diagnosed, you can feel alone and overwhelmed.
There's that fear of like, how do I move forward? What does my life look like from this point forward?
I'm here today with Matt, Jenny, and Megan to talk about the journey that patients have, discovering that they have EoE, what shared decision-making means for them, and the experiences that they've had in selecting their therapies.
I first noticed my signs and symptoms when I was probably around 12 years old. I remember being at camp, eating lunch with everyone. I was eating a peanut butter and jelly sandwich, and it felt like it got stuck in my esophagus. Like I had trouble getting it down. Wasn't exactly sure kind of what was going on, and I don't think I recognized it at first. I thought, food was just pretty dry and I needed like liquids with every meal. Like I didn't think that was anything abnormal, so I didn't really discuss it with most people.
So our son was very similarly, had some early symptoms, vomited a lot. We would have somebody over to eat, and here our son would be kind of, choking or having difficulty. He'd need to go to the sink almost immediately to start regurgitating the food up. I blamed it on the size of the food that he was eating.
Mine wasn't speaking yet. He was so young. It was just such frequent vomiting that I knew something was wrong because I just never knew at what point he would be throwing up again. And so that was my biggest indicator. So we were seeing our pediatrician frequently, and she was actually even having us come in for weight checks because she was so worried that he was falling off the growth curve.
Food should never get stuck on the way down. You should always feel like you swallow it and it goes down. Spitting food out, pocketing the food in the mouth, even sometimes gagging and choking, that definitely needs a workup. When I'm talking to a patient for the first time about a new EoE diagnosis, for me, I'm really focused in on the fact that this is chronic disease. They're most likely gonna have it lifelong. And that if we don't really treat this disease, it's gonna lead to narrowing of the esophagus, which means food's gonna get stuck. We have great options now for treatment, and I'm very interested to hear what your experiences are hearing that you had EoE.
I remember first hearing about the symptoms of it, but that it is manageable, that there are treatments, available, and then quickly moved into what that treatment discussion was.
It's overwhelming. You feel like you're just on the precipice of like climbing up a mountain. There's just a lot to figure out. I definitely had to go to my physician with a lot of questions, but sometimes that could be months in between, and so trying to piece together things on your own, it was hard to find good information.
I had a lot of guilt that I reflect back upon because I didn't trust my son and what he was trying to tell me. I was always thinking there was a different reason for his symptoms. There was a point in time when we were in the pediatric gastroenterologist's office, and she was explaining to us that, getting food caught in your throat is actually likely a symptom of EoE. And I remember my husband and I looking at each other and we have just totally let our child down.
I can appreciate that because I think as moms, we feel a pressure to catch everything and catch everything early and be on top of everything.
I think it's really common among parents. My general plan is to tell them right in the beginning, you should not feel bad about whatever it is you perceived was going on. You had no idea, and in fact, many of your healthcare providers don't recognize it that quickly. For some patients, they really have a hard time communicating the symptoms, or the symptoms they're complaining about really are not well understood. And I'm wondering if you could talk about the challenges that you faced in really helping your physicians to understand maybe what was going on.
Everything I was describing, they were like, that could be normal. So it's like, how do you know that you're not just being oversensitive, overzealous?
I think that's where we sometimes can miss that diagnosis too, is when it seems like it's normal, but really there's something underlying. And I think in all your cases, it really speaks to the fact that there were a few clues and it just really required those right questions to be asked. How much did you rely on the physician to help guide you into a decision? I definitely think the empowerment part of it's so important, that you feel that you have a big role and your child has a big role in making that decision.
So you go in with a lot of questions. You want to know some answers, right, that you can't maybe find online, or some general experience. Having the questions and that comfort level to be able to ask that and walking out of there comfortable with a decision, but also knowing what the next step is going to be.
One of the things that's really important to think about in terms of moving forward with your EoE journey is really talking to your healthcare provider and asking a lot of questions. What are my options? Have I exhausted everything that I can try? Are the symptoms that I'm having part of my EoE? Is there something that hasn't been figured out?
So for me, when I was presented with the elimination diet, I'm involved with a lot of endurance sports. So it's really important to keep up my carbohydrate intake. Having a discussion with my doctor saying this doesn't fit my lifestyle, endurance sports are really important to me and something I want to continue doing. So I don't think this is a good option for me. And talking about, is there any other options available for me?
Yeah, I actually remember being on a walk with my son when we received a call from our gastroenterologist explaining that his eosinophilic count was still kind of high. And so we had asked what else would be available. And that's when she had suggested DUPIXENT.
I do prescribe DUPIXENT to a number of my patients. I think it's a good option as it's a biologic, it's not an immunosuppressant or a steroid, and dosing is really a benefit to patients. So for me, when I'm thinking about putting a patient on DUPIXENT, it's typically because I've tried other treatments or there's some concerning aspects of their EoE. We talk about the potential benefits, so the potential for improvement in symptoms, improvement in how the endoscopy looks, as well as improvement in the inflammation. And then we spend a lot of time talking about the risks. I really am very transparent with patients about potential side effects, things like injection site reactions. Matt, I'm wondering if you could tell me how your doctor talked to you about DUPIXENT.
Sure. So my doctor talked to me about the benefits and risks about all the medications I was taking, including potentially taking DUPIXENT, and talked about how it could potentially reduce difficulty swallowing and how it could impact me.
I know for us, for DUPIXENT, we were able to go ahead and get our eosinophilic count down, whereas when we started this process, it was over 100. They call it a medication choice because for us, it's every 2 weeks. He knows exactly what day it's gonna be. You know, we're ready for it. He's asking me when we're gonna go ahead and take our injection today. We're doing it and we move on with our lives.
Did you see improvement in the symptoms as well?
Fortunately for us, we've not had a food impaction since he started on DUPIXENT.
That's great news.
Yeah.
Jenny, Matt, I was curious, what advice would you guys give to other people who are struggling with their EoE symptoms?
I would say to talk to their healthcare provider about different options for them, what's going to fit their goals, their lifestyle. There's treatment options out there that are available and have been shown to improve symptoms.
It's a lot to be a parent and to have to make a decision on behalf of your child when they're unable to make that decision, and to collect all the information and make sure that it's something that fits their needs.
I think taking the time to really understand and come up with a game plan that you're comfortable with your provider will really give you a lot of confidence. Don't be afraid to stick up for yourself and ask questions, and if you have concerns, to bring those up. And you're going to get there, you know, day by day. You're going to climb that mountain, you're going to get there, and it will be a new normal.
I would add that you're not alone. Like, you're in this journey with an entire team around you supporting you, because we all need, you know, somebody to kind of lean on, and you've got this. There's a good place that you can get yourself to.
Indication: DUPIXENT is a prescription medicine used to treat adults and children 1 year of age and older with eosinophilic esophagitis, EoE, who weigh at least 33 pounds, 15 kilograms. It is not known if DUPIXENT is safe and effective in children with EoE under 1 year of age or who weigh less than 33 pounds, 15 kilograms. Important safety information: do not use if you are allergic to dupilumab or to any of the ingredients in DUPIXENT. Before using DUPIXENT, tell your healthcare provider about all your medical conditions, including if you have a parasitic Helminth infection, are scheduled to receive any vaccinations. You should not receive a live vaccine right before and during treatment with DUPIXENT. Are pregnant or plan to become pregnant, it is not known whether DUPIXENT will harm your unborn baby. A pregnancy registry for women who take DUPIXENT during pregnancy collects information about the health of you and your baby. Are breastfeeding or plan to breastfeed? It is not known whether DUPIXENT passes into your breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you are taking oral, topical, or inhaled corticosteroid medicines, or if you have EoE and asthma and use an asthma medicine. Do not change or stop your other medicines, including corticosteroid medicine or other asthma medicine, without talking to your healthcare provider. This may cause other symptoms that were controlled by those medicines to come back. DUPIXENT can cause serious side effects, including allergic reactions. DUPIXENT can cause allergic reactions, including skin reactions, that can sometimes be severe. Stop using DUPIXENT and tell your healthcare provider or get emergency help right away if you get any of the following signs or symptoms: breathing problems or wheezing, swelling of the face, lips, mouth, tongue, or throat, fainting, dizziness, feeling lightheaded, fast pulse, fever, hives, skin rash, including rash that looks like a bullseye, or painful red or blue bumps under the skin, general ill feeling, itching, swollen lymph nodes, nausea or vomiting, joint pain, or cramps in your stomach area. Joint aches and pain. Some people who use DUPIXENT have had trouble walking or moving due to their joint symptoms, and in some cases needed to be hospitalized. Tell your healthcare provider about any new or worsening joint symptoms. Your healthcare provider may stop DUPIXENT if you develop joint symptoms. The most common side effects in patients with EoE include injection site reactions, upper respiratory tract infections, cold sores in your mouth or on your lips, and joint pain, arthralgia. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of DUPIXENT. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Use DUPIXENT exactly as prescribed by your healthcare provider. It's an injection given under the skin, subcutaneous injection. Your healthcare provider will decide if you or your caregiver can inject DUPIXENT. Do not try to prepare and inject DUPIXENT until you or your caregiver have been trained by your healthcare provider. In children 12 years of age and older, it's recommended DUPIXENT be administered by or under supervision of an adult. In children 1 to less than 12 years of age, DUPIXENT should be given by a caregiver. Please see accompanying full prescribing information, including patient information.